Washington Journal continues.
For the next hour, we're going to talk about marijuana laws in the United States, this especially because of changes that occurred on January 1st in Colorado, allowing the sale of recreational use marijuana. To start off this segment, we're going to get an on-the-ground approach to what's happening and some related issues with the Denver Post, Allison Sherry. She joins us by phone. She's their Washington correspondent. Miss Sherry, thanks for joining us.
Thank you for having me.
For this, since January 1st, could you give our viewers a broad sense of what's been happening on the ground there in Denver or in Colorado overall?
Yes, I haven't been to Denver since the marijuana law has taken effect. So what I've read from my colleagues have been covering very well is the sort of first week and a half of the pot shops being open. They opened on January 1st. About 24 or so are now open, mostly in the Denver area. It's really gone pretty smoothly from everything that we've seen. There have been some arrests. There's been little things here and there, but it hasn't. It's gone smoothly, and it hasn't, caused the ruckus that I think some people were predicting. So I think Colorado has gotten some national kudos for pulling this off in the least disruptive way as possible.
And I guess for those folks there, they're taking a long-term approach to see what, whether the results or unintended consequences or whatever from the decision that was made as of January 1st.
Yeah, I think nobody knows that I think there may be unintended consequences, and there are laws in place for driving with THC levels in your blood. There are laws in place for not having pot on national property, national parks, national forests, national monuments, all off limits. There are rules still being sort of worked out, and there may be unintended consequences, but it's only been 11 days, so I don't think we've seen it yet.
We just saw it, Allison Sherry, a couple of spin-off stories actually stemming from the decision. This one from Colorado legislators taking a look at some of the financial background to the decision. Could you tell us a little bit about what's going on?
The members of Congress, one of the main problems with Colorado's with Colorado and actually a lot of other places that have medical marijuana dispensaries is that the dispensaries themselves cannot open commercial bank accounts because it's still under the Controlled Substances Act. Under federal law, it's still illegal. That a lot of the banks, it used to be that there were a lot of local banks, and now most banks are federal banks with FDIC backing. A bank like Wells Fargo or Chase is not going to allow a medical or a marijuana retail shop to open a commercial bank account because it's still against federal law, which means most of the shops in Colorado, and I'm assuming elsewhere, although I haven't done the reporting on that, are operating on cash only, which is obviously very dangerous for the employees and for the store itself. It's a target for burglaries and that sort of thing. So a number of our members of Congress, Colorado has 9 members with the 2 senators, are working on trying to get that fixed. There's a law pending in the House of Representatives that hasn't gone anywhere. Representative Ed Perlmutter, who's a Colorado House member, has introduced. But yesterday, a number of them sent a letter to both the Department of Treasury and the Department of Justice seeking some guidance on how banks can help these businesses. Because I think the banks would be fine with having a commercial bank business with a marijuana retail shop. They just don't want to face any federal prosecution on breaking a federal law. So we're trying to work that out now.
Allison Sherry, one of the stories you wrote about this topic this week or recently takes a look at the other states that may be considering changes because of what's going on in Colorado. Could you give us a snapshot of what you found out?
Well, Colorado and Washington were first. Washington hasn't implemented their law quite yet, but I think you're going to hear later from somebody from Seattle. But, yeah, there are a number of other states now that are pushing for this. 20 states plus the District of Columbia already have medical marijuana laws. And now Alaska has submitted signatures. They submitted signatures this last Wednesday, to get it on the August ballot there. And so Alaska may be the next state to have legalized marijuana, just straight up recreational marijuana, not just medical marijuana. And a number of state legislatures are looking at it right now, too.
Allison Sherry with the Denver Post. She's their Washington correspondent, giving us an up-to-date look at what's going on in Denver and other places regarding marijuana laws. Allison Sherry, thank you.
Thank you.
We continue our conversation here on the set with 2 guests joining us to talk about not only the decision in Colorado, but what happens from there. Joining us here in Washington, D.C., Dan Riffle with the Marijuana Policy Project. He is their federal policy director. Dan Riffle, quickly, what is your organization? Tell us a little bit about it and the approach you take when it comes to marijuana laws in states.
Well, we think that marijuana should be regulated somewhat like alcohol, not exactly like alcohol, but our view is that prohibition of marijuana has simply enriched Mexican drug cartels, drug dealers, and other criminals, and that a smarter approach would be to regulate marijuana, tax it, put the business in the hands of licensed tax-paying business owners.
Kevin Sabet joins us from Seattle this morning. He is the co-founder of a group known as Smart Approaches to Marijuana. First of all, thanks for joining us. Tell us a little bit about your group and the approach you take when it comes to legalization efforts.
Sure. Thanks, Pedro, and thanks for joining me, Dan, this morning. Well, essentially, Smart Approaches to Marijuana, or SAM, was co-founded by myself and former Congressman Patrick Kennedy. And we founded it because we believe that though people should not be criminalized for low-level marijuana use, we don't want to see our jails and prisons full of marijuana users. At the same time, we think going for a policy of legalization is more than just a bridge too far. Essentially, we're really worried about the prospect of creating a new industry like the tobacco industry, basically a big tobacco we'd call big marijuana, advertising and promoting marijuana, especially at a time that we know about marijuana's harm to the adolescent brain. And so we're joined by the American Medical Association and the American Society of Addiction Medicine and other concerned physician groups who really don't want to see this this spread because we're worried about the effect on society, especially to young people.
So what do you base those worries on as far as it becoming a bigger industry?
Well, the worries on the bigger industry is that it's already grown exponentially in the last couple of years, with medical marijuana being commercialized and really moving to be de facto legalization, certainly in a state like California, but other states too. There are multi-million-dollar private holding groups, Wall Street investors from New York that are investing millions of dollars in a future marijuana industry. There's a former Microsoft executive, actually from right around here in Seattle, that's teaming up with former Mexican President Vicente Fox, and they have formed what they're calling themselves big marijuana. I mean, we can't really make this stuff up. There are groups saying they want to be the Marlboro version of the marijuana cigarette. They want to be the Anheuser-Busch of marijuana. And so this really isn't about just your right to grow a small amount in your backyard or smoke it in the privacy of your own home. This is about a lot of people making a lot of money. And the problem with that is, just like we've had the tobacco industry and other addictive industries, these addictive industries do not make money off of casual users. In other words, the liquor industry or the alcohol industry or the tobacco industry, the gambling industry, right? They don't make money off the person who goes to Vegas and plays blackjack once a year for his birthday. The casino industry, for example, only makes the vast majority of its profit from very, very heavy gamblers that frankly destroy their lives as a result. Oftentimes. And so the same thing is for any addictive industry, and it will be for marijuana. So you've got to increase your profit. That means you have to start young. Okay, you do have to target young people. That's why we had Joe Camel for so long. That's why we had these industries for so long targeting young people. It's the only way to make money. It'll be the same with marijuana. I don't think we need to imprison folks. I get that. But let's work on something that's, I think, more of a middle ground, health approach, prevention, treatment, not overburdensome in law enforcement, but there's no need to legalize marijuana and open the door to big tobacco, which is what we would do if we didn't do so.
Kevin Sabet from Seattle. Again, you've heard our guest perspectives opening up. If you want to give your thoughts on not only what happened in Colorado, but what's happening in other states and concerns or support you may express, here's how you can do so. We've divided the lines differently this morning as far as legalization is concerned. If you support legalization, here's the number for you to call, 202-585-3880. If you oppose it, 202-585-3881. If you're not sure where you stand on it, give us a call at 202-585-3882. You can also send us tweets and emails expressing those kind of concerns as well. Dan Riffle, your response to what Mr. Sabet heard or said.
Yeah, so Kevin mentioned that, there's this prospect of a lot of people making a lot of money. Well, the fact of the matter is marijuana is universally available to anybody who wants it now, so there's already a lot of people making a lot of money, except now, under Prohibition, those people making that money are Mexican drug cartels and drug dealers and street gangs and criminals. And we think that, a smarter approach is to take that industry that right now is funding organized crime and drug wars and violence and instead put that industry in the hands of taxpaying, licensed, regulated business. You know, the thing about prohibition is, you know, this is enacted under the Controlled Substances Act, and the irony of that is it prevents us the opportunity to do just that and control substances. When you regulate a substance, you give yourself the option to, you know, enact advertising bans, enact taxes, enact rules about when, where, and to whom marijuana can be sold. You know, the classic example being that drug dealers don't check IDs, whereas regulated businesses do. So, you know, people are going to make money just as people are now making money off marijuana. But I think we can, you know, through regulation, control who makes that money, where they make that money, when they make that money, and enact smart rules about, you know, how marijuana is sold.
Mr. Sabet?
Yeah. Well, I think if we think that the underground market is going to be substantially reduced, or in some people's words, disappeared because we've legalized marijuana, we have another thing coming for us. These are criminal organizations that are making money from things like human trafficking, primarily cocaine, methamphetamine, heroin, kidnapping, extortion. Frankly, they're going to change their business tactics, undercut the legal price. In other words, Colorado's saying we're going to tax it to try and make so much money for schools and other things. That means we'll not only have a black market that can undercut that legal price, but we're also going to have an underground market that's almost going to exclusively target young people, because under these laws, young people still cannot buy marijuana. And by the way, it's the same for alcohol, and I think we can all say that people under 21 can very easily get alcohol. It has nothing to do with the fact that liquor stores can check IDs. So, you know, the other thing that I think has been said is that this will help with budgets, and I'm sure there are some callers that think in good faith that we can, you know, help our ailing public education system or our health system. I think what we should know from alcohol and tobacco, again, our only examples of illegal drug and legal industries, is that for every dollar that we gain in alcohol and tobacco tax, it costs us $10 in social costs. So the idea that we're going to pay for things because we're, you know, taxing now upstanding citizens, I think is really a pipe dream.
Mr. Quick response before we go to calls.
Yeah, sure. So, you know, Kevin mentioned, for example, alcohol prohibition, alcohol and our experience with alcohol. And I think that's a great example. You look at our experience with alcohol prohibition. When alcohol prohibition was repealed, we put away people like Al Capone and bootleggers and rum runners. And, you know, we don't still see people, for example, growing hops and barley in our national parks the way that we see people growing marijuana in our national parks. We don't see people hanging out on street corners, you know, selling alcohol in six-packs to kids. It's sold in convenience stores and in regulated environments. Yeah. And the other thing too, you know, Kevin mentioned the $1 to $10, you know, ratio of tax revenue collected versus social costs. I think that's really apples and oranges to compare marijuana to alcohol in that scenario, because, you know, alcohol, studies have shown, is associated with about 8 times more annually per user in healthcare costs, whereas marijuana, not associated with violence and reckless behavior, significantly lower healthcare costs. You can't overdose and die from consuming marijuana. You can overdose and die from consuming alcohol. Alcohol is known as the #1 date rape drug on college campuses. Marijuana is not. So, you know, marijuana is a dramatically safer substance. So to compare marijuana and alcohol and say that, you know, we're going to have the same social costs, I think is really a false comparison.
So as far as we'll get your thoughts in a second. I want to get in a call, and hold on to your thought. We'll go straight to you. Zach is up first. Springfield, Missouri, joining us with our guest. Zach, tell us a little bit where you stand as far as legalization is concerned.
I really believe that it is something that's going to eventually happen, but not with the federal agencies that we are having to contend with. When you're looking at the DEA and the FBI, and these are large entities that are not concerned with what the laws are and are going to do what they're going to do based on what their agendas are. So whether or not it actually becomes a federally legalized substance, I don't think that will happen for probably another 30 years down the road because of those roadblocks. However, legalization, why are we going to come and take the moral high ground now on something like marijuana when we watch people die and we allow the legalization of things like cigarettes and alcohol and at a point in time K2? So there's really a muddy water here as far as the morals that we're going to hold high.
Mr. Riffle, I'll start with you, and then we'll get Mr. Sabet's thoughts on it.
Well, you know, I think there's no question that this is going to be a long, gradual cultural shift. You know, we've changed the law in one state, but we've got 49 states to go. Washington, obviously, later this year. Alaska and Oregon will probably have initiatives on their ballot later this year as well. Nobody expects this to be a change that's going to happen overnight. I mean, this is, the first jurisdiction in the world to regulate marijuana, so it's going to take some time. But as these laws change and as Congress changes, we're seeing more and more members of Congress speak in favor of regulated markets and the good that can do. And I think as funding priorities shift and other attitudes change, we'll see those federal agencies change as well.
And Mr. Sabet, the caller brought up the fact that we still have agencies like the DEA and the Justice Department involved, and the fact that marijuana still is an illegal substance.
Yeah, well, I mean, the DEA and the federal agencies haven't really been concerned with low-level use, frankly, for a long time. They're concerned with drug trafficking, and if we look at our statistics, it's mainly, in terms of prisons, we're looking at drug trafficking, although we shouldn't, undermine the costs that, low-level arrests can have. And again, that's why I think we should reform our current system, not necessarily keep it the same, but I think legalization is a bit far. One of the things, mentioned in terms of, as Congress changes, I mean, it's true, we have a multi-million-dollar marijuana lobby that gives a lot of money now, especially to new people coming into Congress, and frankly, they now have an industry association on K Street, and they're going to be very powerful. And this is exactly the kind of corporate interest, special interest scenario that I think we should try and avoid, not try and add another special interest that's essentially going to be saying things that are totally in contradiction with the science. I mean, the American Medical Association, I think, is an organization most Americans would admire, the American Society of Addiction Medicine. Their point of view from the science says, yeah, it's true, we shouldn't talk about reefer madness and about how, marijuana, if you use marijuana today, you're going to use heroin tomorrow. It's not about making extreme statements, but it is about saying things that the evidence have shown, which, for example, the fact that 1 in 6 16-year-olds that ever try marijuana will eventually at some point become addicted to it, that it doubles your risk of a car crash, that it contributes to millions of dollars of healthcare costs in terms of lung problems. By the way, it contributes to significant reductions in IQ. And one of the interesting comments we heard, Pedro, you probably have been well aware of this last week since we, Colorado did what they did, are people even on the left, like Tina Brown, saying that we're not going to be able to compete with countries if we, are basically the stoned out country with reductions in IQ and health problems. So I actually think that we need to press pause for a minute before we kind of go on this freight train and really think about what kind of country we want to create, but also, are we willing to live with another legal public health disaster as we have alcohol and tobacco? I mean, when I look at alcohol and tobacco, I see those as examples of what we don't want to do. We don't want to create this industry. We don't want to create basically many, many more users. Remember, there are many more users of our legal drugs like alcohol and tobacco than marijuana. About 55% of Americans drink, 27% of Americans smoke cigarettes, and about 8% of Americans use marijuana. Why would we want to bring that 8% number up?
Here is John, and I'll get your response in just a second. John from Memphis, Tennessee. He's in favor of legalization. John, good morning.
Yes, good morning.
Go ahead.
Yeah, I think marijuana should be legal. I mean, we fought every war we can on poverty, on drugs, and we've lost them. I mean, as the speaker said, we've all we've done is enrich the Mexican cartels. I mean, I work with quite a few Latin Americans, and it's basically you're a member of a cartel or you come to America and cook in a restaurant. And I've smoked marijuana for 30 years, and it's the most friendly drug there is. We should fight the war on crack and cocaine and heroin. These drugs are bad. Everyone knows it. Tobacco and alcohol are probably some of the worst drugs ever. Gambling is probably one of the worst forms of addiction. The only type of form of addiction that can ruin your life in one hand.
Mr. Sabet, let me go back to you real quick, though. What about his point as far as why focus on marijuana and not things like crack or cocaine?
Well, we should focus on all those. I mean, the fact that we definitely should focus on that. In fact, federal resources, when you look at enforcement, I mean, Dan and I would agree, they're focused on drugs like cocaine and crack and heroin. We have a prescription drug abuse epidemic. Frankly, the prescription drug abuse epidemic is another class of quasi-legal drugs that, by the way, was pushed by an industry, the pharmaceutical industry. I don't know why we want to create another industry with marijuana. And as we're bringing up other drugs, and certainly this is not the case that I can understand with Dan's organization at MPP, which is really focused on marijuana, but the big money that is funding legalization, the New York think tanks and folks like George Soros and other billionaires, they frankly are focused on legalizing all drugs. They have said the end game is not marijuana. They're starting with medical marijuana, which they've succeeded. Then they move on to marijuana for recreational. Then they move on to other drugs, the other harder drugs like cocaine, heroin, and methamphetamine. I think that's a real problem when we are enriching these special interest groups. And again, Dan, I know that's not where you are on this, but a lot of the money that's been funneled to these states to pass these initiatives, frankly, are tied to folks that want to see all drugs legal. I think that's a concern.
Mr. Riffle.
So first I want to correct a couple of things that Kevin said. First is that, mainly our drug trafficking resources are focused on traffickers and producers and not low-level users. Last year there were about 750,000 arrests for marijuana crimes. 88 to 89% of those were for simple possession of small amounts of marijuana, not for trafficking.
Hold on, let him finish.
Not for trafficking or for growing marijuana. And second was that, our focus is on crack and heroin and other harder drugs, when in fact about half of all federal arrests are for marijuana, federal drug sentences are for marijuana crimes, not for other harder drugs. And in fact, there were more arrests for marijuana crimes than there were for all violent crimes combined. So that's not where our focus is. We do have a predominant focus on marijuana. And my background on this, my view or perspective is as a prosecutor. I was a prosecuting attorney before I joined MPP. And I think when you look at our clearance rates for, rape, assault, burglary, arson, robbery, and other violent crimes, real threats to public safety with real victims, the clearance rates for those crimes are often below 50%. In fact, for all of those, they're below 50%. So I think there's just better things for our law enforcement officers to do. Well, I think their focus should be on protecting us from violent criminals and real threats to public safety, and not arresting people simply for using something that's objectively, by any scientific measure, less harmful than alcohol.
Mr. Sabet?
Well, Dan, I agree with you on all of those things. I mean, a lot of those things, I should say. When it comes to arrests, we are arresting too many people. We need health interventions. Frankly, some folks don't even need those health interventions. It depends on the level of their use. And you and I would agree that we should think about our resources for arrests. But you and I would also know that, you're basing those numbers on arrests when it's imprisonment and jail and other things that cost a lot more money than the arrests. And when it comes to, you said half of our arrests are for marijuana. Well, that's because 95% of illicit drug activity is marijuana. It's it's very small number of people that are using heroin, cocaine, etc. So if you're just going to use raw numbers, then sure, marijuana is going to take the cake. But if you look at percentages and if you look at the numbers for trafficking for people that are in prison, not arrest. And again, I would agree with you a lot on the arrest part, but on the imprisonment part, we really are talking the other drugs. This issue about the criminal gangs that we've kind of left unaddressed, I mean, we know that it's around 20% or less of revenues to Mexican criminal organizations come from marijuana. Okay, so it's not the vast majority of them. We keep talking about that. In fact, well, hold on. It is a significant percentage, and if we could cut that, it would be significant. I happen to believe that, by the way, we still have an underground market in Colorado. It's legal. We're still going to have one when it's further legal. And to the point before that, I think also should be addressed from the reporter that this has kind of gone okay, and people have been waiting in line, and there have been no incidents, only a few arrests. I mean, tell that to the parents of the 2-year-old girl in rural Colorado who ingested a pot cookie, because these are products like cookies, brownies, grape sodas, other items, lollipops, Skittles, that are marketed to kids, frankly look attractive to kids. Kids are ingesting them, and a couple dozen of them last year went to the ER because these 2-year-old brains are ingesting THC. This is the kind of thing that we're going to see, I think, more and more as these companies produce products that are targeted and aimed to kids. And again, I would just say, let's not repeat the disaster of the tobacco industry, and let's not have to wait 100 years to make this kind of industry accountable.
Here's from George, and I'll get a response. Actually, if you wanted to respond real quick.
Yeah, sure. I just want to say that some of the statistics that Kevin mentioned really speak to the disaster of marijuana prohibition and the failure that it is. So many people, 95%, Kevin said something like 95% of the illicit drug activity is marijuana. And it just says that anybody who wants to use marijuana can. Frankly, if you wanted to look for marijuana in this society, the first place you would look is in a high school. It's just a failure. 80 to 90% of high school seniors say that marijuana is easy or very easy for them to obtain. It's pretty much the same percentage that they say for tobacco or for alcohol. So Prohibition has absolutely failed to keep marijuana out of our kids' hands. There's a better way to go. We should regulate marijuana. Again, stores that are licensed and regulated check IDs. Drug dealers don't. There's just a better approach to this.
So we'll get a call and then get your responses. This is George, Brooklyn, New York, Republican line, and you're opposed to legalization. Good morning.
Good morning. How you doing? I just wanted to share a brief experience. I'm against the legalization. I used to have a stepbrother when he was a young kid. He was so smart and he was so terrific, naturally on math. He started experimenting marijuana. And throughout the years, it wore out his brain. His intelligence was completely wiped away. I didn't make any of it. I said, oh, you know, but that's the way he is. Then recently, in our neighborhood, we had 4 kids. 2 of them were experienced with marijuana, and the other 2 didn't. Throughout the course, those 2 that were using marijuana, they become pro-drug culture, and their memory was beginning to erode, and they couldn't keep up. They couldn't advance in education. So somebody could look into long-term use of marijuana and what is it doing to the kids. And
so if you had to boil it down, George, why are you opposed to legalization?
It does something for tomorrow's to our future, which is the kids. It's robbing them from their intelligence, their creativity, and nobody's looking into it.
Mr. Riffle, what would you say to that?
Yeah. So the caller mentioned, you know, this idea of the gateway drug that, you know, people start with marijuana and then move on to other drugs. And Kevin's a very smart guy, and I think that's one reason you're not going to hear him call marijuana a gateway drug. He knows that every scientific study that's ever looked at that subject has said that, you know, marijuana is not a gateway drug. The Institute of Medicine, probably our most prestigious research body, has said that there's nothing about the physiological properties of marijuana that causes people to go on to use other drugs. And in fact, what a lot of researchers suggest today is that marijuana prohibition is what makes marijuana a gateway drug. You know, when you go in Colorado to buy marijuana, you go into a regulated store that sells marijuana and nothing else. Just like when you go to buy alcohol, you go to a convenience store that says alcohol and maybe, you know, potato chips and other snack foods. But when you go to buy marijuana in a state other than Colorado, you go to a drug dealer. And that's true for even our high school students who buy marijuana. They buy it from drug dealers. And those drug dealers have either an inventory of or access to methamphetamines, ecstasy, heroin, crack, and other drugs, and they have a motivation to sell you those other drugs. And so that's how marijuana can serve as a gateway, because you get introduced in purchasing from drug dealers, you get introduced to a market for other drugs.
Yeah. Mr. Sabet?
Actually, yeah, well, first, the market for marijuana right now in the U.S. is actually relatively nonviolent. And Dan is right. The vast majority of marijuana users do not go on to heroin or cocaine. But let's be very clear, the vast majority of heroin and cocaine addicts started with marijuana. So, you know, whether it's gateway or not, I think it's a term nobody really even knows what the definition of that is. We know there's an association. It's the mechanism. That's the question that researchers are looking for. Frankly, when people go to a marijuana store in Colorado, there are other things other than, you know, smoked marijuana. There's a lot of, you know, cookies, candies, and sodas that are marketed to kids. So I think what the essence, though, of George's question and his concern really strikes the fact and the reason why, like I said, almost every major medical association agrees with our organization in order into keeping marijuana illegal, but also to focus on public health interventions, because we actually do have a lot of the research on long-term issues with IQ. Probably the most robust study, I would say almost ever done in the field of drug abuse, at least in the last 15 to 20 years, has been a study looking at people born in Dunedin, New Zealand, the 4th largest city. Over 1,000 people in that cohort, following them for their whole lives, and they're 38 years old now. They started when they were born, and they started asking them all sorts of questions, and basically every 5 years checking in on them. The last time they checked in on them, they found that those heavy, persistent marijuana smokers who started and used when they were teenagers for a few years, for a couple times during the week, basically heavy users, by the time they were 38, they had an average 8-point reduction in IQ. Now, 8 points is enough to take you to the bottom third of the global IQ intelligence scale. It is the difference between a job or not. It is the difference between a degree or not. So what George is saying with his experience of those kids in his neighborhood and his brother and his friends and other people, is true for some people. Now, we're not saying that's true for everybody. We all know people who smoke marijuana that, haven't destroyed their lives, and this is not one extreme or the other. The point is, it increases your chances. And at a time when we're trying to increase public education, increase worker productivity, increase our economy, help others in terms of living a healthy lifestyle, why would we want to expose people to that risk, which there's a significant risk, even if it doesn't happen to everybody, of things like a reduction in intelligence and all sorts of other health problems.
A little bit about our guest. You just heard from Kevin Sabet of Smart Approaches to Marijuana. He's their co-founder, previously had several positions at the Office of National Drug Control Policy and worked in research in this area, also an author of a book on this subject. And also joining us, Dan Riffle, Marijuana Policy Project. He's their federal policy director. Both of them talking about joining us, and you heard about Mr. Riffle's previous career in law. Both of us joining us to talk about issues regarding marijuana laws in the United States. If you're just joining us, if you want to weigh in, especially what happened in Colorado and what's next after that, the numbers on your screen divided differently this morning. If you support legalization, it's 202-585-3880. If you oppose it, 202-585-3881. If you're not sure, 202-585-3882. Here's someone who's in favor. This is Nick, Glendale, Arizona. Good morning.
Good morning. I figured it's time you guys had an expert on the show. Mr. Sabet, I got a question for you. It says you say you do research. Have you ever smoked marijuana?
I have not, but I frankly think that's that's an irrelevant question. Well, hold on. I got to be able to answer your question completely.
Sir, excuse me.
All right,
well, Mr. Sabet, let him finish.
I asked you a question. You gave me the answer. Please just give me an opportunity to talk, because I have very limited time. You don't. Sir, here's the thing. When you talk about research, okay, I've been smoking marijuana. The first joint I smoked was with my scoutmaster when I was 11. I'm a 50-year-old man. What I'm trying to explain to you is this. First of all, research is what I did, not what you do, okay? I've been smoking for 35 years. And let me tell you this. I smoked almost every single day of my life. And as far as, I have 5 children, by the way. 3 are, one just graduated summa cum laude from Arizona State, and the other 2 are in college.
Great, congratulations.
None of my 5 children smoke marijuana, although every one of them has been told, when you turn 18, if you are interested, you please come talk to me. And they said to me, well, Dad, would you recommend it? And I said, well, listen, I'm not a hypocrite. I couldn't smoke it for 35 years and then tell you it's not a worthwhile drug. I think it's the best thing God ever put on earth. Having said that, I said, but you know what? It's illegal. And there's people out there like Mr. Sabet who get paid by God knows who. I'd be very interested to know who funds you.
Oh, I'm very happy to tell you.
To tell you things like, I'm from the age of, we still had, what was it called, reefer madness? Let me tell you something, sir. Mm-hmm. The reason marijuana is illegal has been, and all anybody has to do is do the history and research, is it's been racist. It's been about things like the hemp products, which outlast so many of these other products that are made from petroleum. It's been about a lot of things.
Okay, and we'll let Nick there, Mr. Sabet, if you wanted to start.
Well, sure. Well, I mean, I don't think anybody would say that, a cocaine researcher who works in the National Institute of Health needs to use cocaine in order to be able to talk about it or research it, or that somebody that researches why people commit suicide in the mental health crisis needs to have that attempted suicide in order to do that. So, I guess, what I would say is this has been a very polarizing discussion, and frankly, we need to turn the temperature down a little bit. That's why it's nice to talk to Dan at 5 in the morning, and you, Pedro, and have a rational, sane conversation about marijuana policy without getting all worked up. I don't deny the fact that the originations of some of our drug laws certainly came from places that we should be shameful about. And frankly, I thought that the previous caller talking about how the Latino minorities in his area that were either working at a restaurant or he said were a part of a drug gang, and he was therefore in favor of legalization, I also found very, very offensive. So look, we've had that racism then. We certainly have it today. Insofar as our our policies are contributing to racism in terms of disproportionate arrests for minorities, in terms of lost job opportunities, so that if you're arrested for any drug, by the way, not just marijuana, that you're denied a job later in life, even if you're off of that drug. I think those are shameful too. And I think that we need to work on repealing those. I think we need to reform those. We need to really look at our police practices in terms of the disproportionate representation. I don't think anybody can say that they're proud of the way the disproportionate representation in the criminal justice system. So I think those are very serious issues. I don't take them lightly. But at the same time, I think it's a bit jejune to accuse somebody who hasn't tried something that they can't necessarily talk about it.
Mr. Riffle.
Yeah, I'll just take a second to elaborate a little bit on that disproportionate racial impact of our arrest rates in this country. The ACLU just did a seminal study a couple of months ago that was released called Marijuana in Black and White. And what they found is that even though blacks and whites use marijuana at the exact same rates, blacks are anywhere from 3 to 8 times more likely to be arrested for marijuana crimes than are white people. In fact, here in D.C., we have the second worst disparity in the country. Blacks are 8 times more likely to be arrested for marijuana possession, even though they use marijuana at the exact same rate as whites. And I think that you can just add that to the very long list of reasons that we need to stop arresting and prosecuting people, again, just for using a substance less harmful than alcohol.
Let me squeeze in a call, sir, and I'll get back to you. Woodbridge, Virginia. Peter, he's not sure, and you're on our independent line. Good morning.
Good morning. My question is for Mr. Riffle. It has to do with advertising. Of course, during the Prohibition days, alcohol was, when it became legalized, it was allowed, corporations were allowed to advertise it. Likewise with the cigarettes, and now both of them have been in a restrictive form of advertising. Mr. Riffle, do you favor that marijuana should be legalized throughout the United States, that it be able to advertise?
And just so you add, Jody from Twitter talks about the same things, saying that ads just like the beer commercials, I can see them now sitting on a cloud watching a rainbow. Mr. Riffle.
Yeah, I do favor restrictions on advertising for marijuana, just to be clear about that. To hear the caller, Kevin, say it, you'd think that our kids are seeing commercials for Virginia Slims and liquor while they're sitting down to watch their Saturday morning cartoons, but we know, in fact, in reality, that that's not the case. In fact, I haven't seen tobacco commercials on television in my entire life. There's every reason to believe that we can enact sensible restrictions on advertising for marijuana. And in fact, just to further develop that comparison with tobacco, Kevin talks a lot about the disaster of our experience with tobacco and big tobacco, and I think he does a good job of comparing marijuana to tobacco from the 70s, but not to tobacco today, because frankly, we have a pretty good approach to tobacco today, and we've actually reduced tobacco use, both amongst adults and teens, to historic lows. In fact, our teen cigarette use has never been lower than it is today, and we haven't had to arrest and prosecute 750,000 people every year in order to achieve that success. So there's no reason to believe that we can't take those same lessons that, frankly, have been a historic success story and apply those same lessons to marijuana.
And even though I know it's different, you see those commercials for waterless or the water vapor cigarettes now, and some of them, question about the glamorization of it and the style of commercial. I know it's not tobacco strictly, but just to give an example.
Right, and it's also an example of harm reduction. Kevin talks a little bit about the damage to the lungs, and in fact, the Journal of the American Medical Association just published a study saying that light to moderate marijuana use actually doesn't cause harm to the lungs. But regardless, if there is harm to the lungs, we can actually reduce some of that harm through smokeless forms of consumption.
Mr. Sabet?
Well, a couple things. I mean, yesterday in my inbox from Groupon was the biggest ad, their item of the day was a vaporizer that they didn't mention the word marijuana, but clearly that's what it was for. And actually it was for taking in these waxy concentrates of up to 80% THC that have caused emergency room admissions and are extremely dangerous. They just blew up the foundation of a building in Seattle when somebody tried to light that butane hash oil. We're seeing the fact that today's marijuana, let's be very clear, is extremely different than the marijuana that maybe Dan or our parents smoked in the 60s or 70s. And we're talking like 2 to 3% THC at that time to an average of 14% THC and upwards of could be around 30% THC even of smoked marijuana. It has a very big difference. Now, in terms of what the caller talked about with advertising, yeah, I mean, we're seeing that now. We're seeing, you know, I wish everybody would have frankly, the sense of Dan and some of his other colleagues who are saying they want to restrict. Unfortunately, they don't. We're seeing this industry emerge all across the country, especially in Colorado and Washington, but also California, where people are saying with reckless abandon, they will use their rights under the First Amendment, which the Supreme Court has argued commercial speech is free speech. They will use that right as far as they can to be able to promote this. And the only reason we've restricted tobacco is after, first of all, 100 years of misery, and then essentially we cut a deal with the tobacco companies, putting them out of business, prohibiting out tobacco, or they had to curb their advertising practices. Certainly they chose the latter, but other industries, other addictive industries continue to advertise. And I think, you know, the reason why our cigarette use is so low, and I'm so happy about that, it's a public health victory among teens, isn't because it's legal. It's been illegal. It's been legal forever. The reason why our cigarette levels are so low is that we have a whole societal effort, a stigma against smoking cigarettes. I mean, it couldn't be more
just as we can have
uncool.
against marijuana without arresting people.
Well, no, but the thing is with marijuana, Dan, we have groups like yours and others that are saying marijuana is safer than this substance and it's actually not that bad for you and the studies are mixed. And it's sort of exactly what the tobacco industry said for 50 years about questioning the science. I mean, you have the AMA on one side, Dan, and frankly, your organization on the other.
Let's get a response from Mr. Riffle real quick.
Let me just say, frankly, categorically, marijuana is harmful, Kevin. No one is saying that marijuana is harmless. Yeah. Marijuana is harmful, and our mission is to reduce the harms of marijuana with the focus on the fact that marijuana prohibition is the greatest harm. You know, the harm that can be done to you by using marijuana pales in comparison to the harm that can be done to you by being arrested for marijuana.
Well,
you're denied a job.
Hold on, let him finish.
And I also want to talk about, you know, Kevin mentioned emergency room admissions and the fact that, you know, people who are using, you know, concentrated forms of marijuana have been admitted to emergency rooms. The sponsor of our medical marijuana bill in Maryland is an emergency room physician, and he's sponsoring that bill because he agrees with me that marijuana is dramatically less harmful than alcohol, and he knows that from his experience. As an emergency room physician,
marijuana?
He routinely sees people admitted to the emergency room for alcohol. In his 30 or 40-year career, he's seen 2 people admitted for marijuana, and in both cases, he said, just go sit in the corner for about 20 minutes, you're going to be fine. You know, it's just a fact. Marijuana is dramatically less harmful than alcohol, so why we would arrest and prosecute people for using marijuana and thereby drive people to drink just doesn't make any public health sense to me.
Mr. Sabet.
You know what, let's talk about this. The studies about marijuana and this idea that there's a substitute does not hold among arrestees and heavy users especially, which is really the population we're looking at, not the person that occasionally uses. The heavy users of those substances use both of those substances. And the idea to say that one is more harmful than the other, so therefore we want you to use A, not B, is like saying, you know, cervical cancer is a 20% mortality versus breast cancer, which is a 10% mortality. So we really want you to get breast cancer instead of cervical cancer if there's a choice. There doesn't need to be a choice. I mean, the point is both from a health perspective are not a good decision. Yeah, alcohol contributes, Dan, you and I would agree, to violence in a bigger way than marijuana does. But marijuana in many ways contributes to things like reduction in IQ or motivation, the lung issues in a way that alcohol doesn't. They have different harms. They're different drugs. For young people, they both should be discouraged. And this idea that we want to substitute one for the other, I think is a good political talking point. But when you look at, again, what the AMA and the American Society of Addiction Medicine and what the National Institutes of Health have said is that we don't want to encourage one substance over another. They're both harmful.
So let's let Mr. Riffle get a quick response and then we'll get to calls.
I agree completely. They're both harmful and we should discourage use of both. But right now, we're discouraging use of marijuana by arresting and prosecuting 750,000 people and by burying that market and we're burying that industry in an underground market, funding cartels and drug dealers and criminals. You know, again, you've talked about the lessons that we've learned from tobacco and the public health success story that we've had with tobacco over the last 15 years. Let's apply those same lessons to marijuana.
Here is William.
We have a marijuana lobby.
From North Carolina. He's opposed. Good morning.
Good morning.
Hi, go ahead.
It's just another nail in the coffin of the United States and the world. So, you know, it's a drug. You get out here on the highway smoking it. So it's pretty simple to me. It's just another drug. So that's about the comment that I'd like to make.
But why are you opposed to it?
Well, the law, if it's an illegal drug, I mean, it don't make no difference. Just like alcohol. We're talking about alcohol. What happened to it all the years? You know, you get arrested for it. It's still a legal drug. You can't get arrested because it's a legal drug. That's a joke. Well,
and ultimately, Mr.
That's
Riffle,
actually
hold on.
A great point.
Mr. Hold on. We'll get
I just want to
get Mr. Riffle first. Any response to that?
Sure.
Yeah, I mean, you know, like the caller said, you know, it's a harmful drug, and you know, Kevin said earlier that we should discourage consumption because it's harmful. Well, you know, eating fast food cheeseburgers is harmful as well, but we don't discourage that by arresting and prosecuting people who do that. We don't arrest and prosecute people who are obese as a way to encourage society to be skinny. You know, there's just smarter ways that we can enact public policy measures in order to discourage drug use or encourage healthy behavior than arresting and prosecuting people.
Mr. Sabet.
Right. So I would say that, sure, I agree. There are smarter ways. Let's reduce the arrest rate. Let's look at this in a non-enforcement way and more in a public health point of view. But we don't need to go all the way over to legalization, where we're going to have this industry that's going to put it in people's faces. And frankly, it does promote and target to kids. I just want to say what the caller's last point was a very nuanced point that isn't discussed in these debates, and I'm glad he brought it up, about are we really going to reduce the number of arrests even if we legalize something? What is the number one drug that police work with in terms of their time, and the number of arrests a year is alcohol. 2.7 million arrests, not for violence related to alcohol. I'm talking things like regulatory laws, so public consumption, selling to minors, driving while intoxicated, not the violence part, is double than all illegal drugs and about 3 times than marijuana. So, and the reason is you have more users, you frankly have more laws to break because there are all these regulations now being created around it to try and reduce the harm as much as we can. And actually, alcohol drives more people to the criminal justice system than marijuana does. So if your only objective is even to reduce arrests and reduce criminal justice involvement, I think there are many smarter and better ways than following a model like alcohol, which is what MPP and other groups have modeled on, which has not only been a public health disaster, but frankly has been the cause of 3 times as many arrests than marijuana today.
So what's the best model then?
Well, I think the best model focuses on prevention, early intervention, treatment if necessary, fines when necessary, but yes, keeping it illegal. And obviously, all choices in drug policy, and this is what, Dan and I would also agree with, all choices are bad. There are no perfect choices. Drug policy is complicated. There are trade-offs. There are vexing complications and consequences depending on which trade-offs you're happy to live with. Prohibition is certainly not perfect. It produces harm. We talked about some of those harms today. We both, I think, would want to reduce those harms as much. But when you balance it out at the end of the day, I think, and again, I'm in alignment with the House Minority Whip yesterday. Steny Hoyer came out against marijuana legalization, as have so many people recently. With those folks and the AMA in saying that at the end of the day, it's better to keep it underground than it is to have another tobacco or alcohol industry, which is the inevitable result. The idea that we're going to control this in a safe way, that is what voters were promised in Colorado, Pedro, and as you've read, I'm sure, now in Denver, they're throwing those rules out the window. You can have a store within 1,000 feet of schools. You can smoke it in your front lawn, even if it's in public and you're in a condo complex and it affects other people. And there have been many reports of secondhand exposure now to marijuana. So the promises of the campaign that this can be regulated and controlled get thrown away to the side when the industry and the lobby, which stands to make a lot of money from this, gets in there and gets their own rules in, which are essentially no rules. And so rather than have that scenario, let's fix current policy.
Dan Riffle, Mr. Sabet mentioned Steny Hoyer going on the House floor talking about his concerns about it. We have a bit of that statement from the floor speech. We'll listen to it and get your response to it.
Sure.
A long time ago, there was a mayor of Baltimore, Kurt Schmoke, a very extraordinarily able guy who had been a state prosecutor and suggested the legalization of marijuana. And my initial reaction was a positive one Then as I talk to people who deal with drug abuse issues, with rehabilitation issues, I became convinced that marijuana was in fact a threshold drug and that it would lead to the use of harder, very harmful drugs, so that I'm not a proponent of the legalization of marijuana.
Apologies, that's from our Newsmakers program, which you can watch tomorrow right after this program, but Dan Riffle, go ahead.
Well, I think we heard, you know, the representative called marijuana a threshold drug, which was his terminology for a gateway drug. And we've had that discussion already, and as Kevin and I would agree, the idea that marijuana serves as a gateway is just false. Every study that's ever looked at it has said that marijuana is not a gateway drug, and in fact, it's Prohibition, which puts marijuana in the hands of drug dealers, that makes it a gateway, because kids, you know, who want to obtain marijuana have to obtain it from a drug dealer who has access to other drugs.
Here's a supporter from Colorado. This is Joe. Good morning.
Hey, how y'all doing? I just wanted to get in the conversation because I think we're overlooking the whole issue of, you know, addictive personalities in North America, the stress of being in the ghetto. You know, like, there's a lot of things going on in our country, and marijuana right now in Colorado is getting so much advertisement. We're bombarding our society with something that the voters in the United States chose to do in the state of Colorado. And it's not that we have a drug problem here. You know, we got crack cocaine, we got ski resorts, we got a lot of things we offer to our citizens of our country. Now, you got to think about it for a second. I do support legalization of marijuana, but I do not support it if it's going to be like something that we have to vent about. You know what I mean? Like, you guys are not talking about people that are being locked up for marijuana right now, tonight. You're not talking about, you know, addictive personalities in America, stress-based, you know, environments, and what we do in this country and how it affects other people in our country.
Mr. Riffle, what's the takeaway from that?
Well, the caller mentioned addictive personalities, and I think that's an important point. Let's look at what exactly is it that gets people hooked on certain drugs. The Institute of Medicine we talked earlier about is our most prestigious research body in the country, and they looked at various drugs and what percentage of people who use those drugs go on to become addictive. With marijuana, it was about 9%. With alcohol, it was 15%, and with cigarettes, it was about 30%. So statistically speaking, marijuana is one of the least addictive drugs that we have out there. Yeah. And speaking of addiction, you know, Kevin mentioned this notion of stressing treatment and prevention. I agree that we should stress treatment and prevention, but I also think we could regulate marijuana. The difference between Kevin and I is I don't see why those are mutually exclusive values. In fact, I think by regulating and taxing marijuana, we can use revenue that we derive to fund treatment and prevention services. And I think by regulating marijuana, we can disconnect that gateway between marijuana and other drugs. You know, again, going back to that gateway theory, when it's regulated, we don't have people going to businesses or dealers that also sell other harder drugs and have an incentive to get you addicted to those drugs.
Mr. Sabet, yeah, I mean, nobody in treatment or prevention would say that they are making, from alcohol, would say that those revenues are getting to them. Like I said, for every dollar we gain in alcohol and tobacco revenue, it costs us 10 in social costs. The last time I checked, the lottery, which was passed in every state, almost every state, to help fund and frankly fix our ailing public education system, I think we'd all agree that that's not going too well. And it's because we get all these promises for revenue and they never materialize. And folks probably, you know, when you had Daniel Okrent has been on this show before, or on this network, and he talked about reasons why we repealed alcohol prohibition. The chief reason that the lobby got behind the repeal of alcohol prohibition was because they were promised the no more need for a federal income tax, and we know how that story ended. So we've been promised this revenue from things for so long, it hasn't materialized. In terms of, I got to correct something that Dan said on the addictive rate of different drugs. That is just about right. We can quibble on some numbers for adults, but what we're concerned really is with adolescents. And actually, alcohol and marijuana are about equally as addictive for adolescents. That means that 1 out of every 6 kids that begin using marijuana or alcohol actually at that time will become addicted. And actually, if you start at age 14, it's 1 in 4. And that's because the developing brain is really forming and priming and developing really who it's going to be up until about age 25 or 28. And so those drugs can affect you that way. Is it less addictive for kids than tobacco or heroin? Yes. But again, it's like saying this part of cancer is less likely to kill you than this other one. They're both not desirable things that we want to do. And as long as we start legalizing marijuana, and frankly this agenda that others have, not Dan but others, to legalize all drugs, you know, we're going to have kids start earlier and earlier, and we are going to produce the kind of addiction that frankly is going to cost society, not just financially, but also in terms of the kind of country we are.
Let me get both of your thoughts on public perception issues. CNN did a poll this week on January 6th talking to people about legalization and what they thought about it, saying 55% said the use of pot should be legal, 54% saying sales should be legal, 32% weighing in saying that pot use was moderately serious. Mr. Sabet, what do those numbers tell you as far as public perception of this issue?
Well, clearly, I mean, Dan and I would agree with this, that there has been a shift in the last, 10 to 15 years in favor of legalization. I mean, no one's going to deny that. Although what we always forget is the fact that, 5 states previous to Colorado and Washington actually defeated legalization, one of them being Oregon in 2012, and it somehow doesn't get mentioned. But what's interesting is that in the 2 states that this has passed, both of those states outspent their opponents something like 5 or 6 to 1. So, yeah, when the message is out there that this is safer than alcohol and this is going to give you revenues, I think a lot of people think it's worth trying. We should be able to grow a plant or 2 in our backyard. I should be able to possess it and not go to prison and not go to jail. And so the public perception changes. Of course, a lot of that's based on really shaky information that doesn't comport with groups like the AMA. One poll I didn't hear you mention, Pedro, that I think we should, is the Rasmussen poll that came out last week that only showed 42% support. Polls, the Gallup poll is more in line with CNN poll. The Rasmussen poll is more in line with the traditional other polls that we've had last year. I think, we're seeing, it's very interesting that we're seeing, different polls showing very different numbers. Clearly, there's a trend upward. Dan and I would agree with that. I think one of the most useful gauges, which I don't believe it's come out, and Dan, you can correct me if I'm wrong, comes from the General Social Survey, which is really the survey that academics use as a much more accurate barometer of attitudes and behaviors in America. That for 2012 was around, I think, 43%. We don't have the 2013 numbers in yet. Obviously, we'll see. Alaska and Oregon may be the 2 that are going to vote on it next. But frankly, I think a lot of people are seeing how things are going in Colorado. They're noticing the advertising and their marketing. And I think that people may have second thoughts when they see that, wait a minute, I thought I was just voting for personal liberty and the right to grow a plant or use it. I didn't realize I was voting for essentially creating this industry. Is this what we really want? So
Mr. Riffle,
time will tell.
Yeah, so first of all, this notion that we were able to outspend our opponents 6 to 1, there's a reason we were able to outspend our opponents, and that is we don't have that many of them. I don't know too many people other than Kevin who are interested in defending a policy as disastrous as marijuana prohibition has been. And second, going back to this notion of addiction rates.
Kennedy, you have
this going back to this notion of addiction rates and the idea that marijuana is so addictive to our young people. If that's true, then we should pursue public policies that are effective at preventing access to marijuana for our young people. And we know that marijuana prohibition has failed. Again, 80 to 90% of high school seniors say that marijuana is easy or very easy to obtain. And I want to go again back to tobacco. The Monitoring the Future survey, it's released every year, which shows teen use rates for tobacco, alcohol, marijuana, and other drugs. And the findings last year showed that more kids were using marijuana than tobacco. And in fact, so what that says is that we've reduced tobacco consumption to below our marijuana consumption rates. And so what that says to me is that the model that we have for tobacco, which discourages advertising, which promotes honest education to our kids, and which encourages parents to talk to their kids about tobacco use, has been effective at reducing tobacco use rates amongst our young people to historic lows. And again, we haven't had to arrest and prosecute 750,000 people every year in order to do that. So that's a policy that's actually been effective at reducing teen use. Marijuana prohibition is not. So I think that's a smarter approach for us to pursue.
So before we get your before we get your final comments, let's weave in one more call. This is Deirdre from London, England. She's opposed to legalization. Go ahead.
Hi, good morning to you. First of all, a question for Dan Riffle. He says that marijuana is more dangerous than alcohol because it kills more people. But legalizing marijuana means more people will use it, particularly the young, as has been discussed during their developmental stage. So the harms and the deaths from legal pot will rise to match those of other legal drugs. And also to compare it with alcohol is a diversion. It is more accurate to compare legalizing align pot with increasing human traffic and slavery, because that's what the drug cartels are going to. I'd also like to say he has not read the headlines. It is utterly untrue that marijuana does not cause violence. There are people who have murdered. There are school shootings and massacres by people on marijuana. And it is also known, whether you believe that marijuana leads to schizophrenia or not, it is absolutely true that a lot of people, too many people on schizophrenia, will not take the drugs they need when they go on pot.
Mr. Riffle, you want to start first?
So, the notion that marijuana leads to violence is just absurd. And, when I say that marijuana is not associated with violent behavior, whereas alcohol is, I'm saying that based on what I've read from the Department of Justice and my experience as a law enforcement official myself. And I also want to talk about this notion that legalizing marijuana will necessarily mean more use. When you look at other countries with more permissive attitudes towards marijuana, for example, the Netherlands, where sales of marijuana have been tolerated, relatively legally for decades, fewer teens actually a smaller percentage of teens actually use marijuana in the Netherlands than do here in the United States. Portugal legalized all drugs a few years ago. Fewer teens use marijuana in Portugal than in the United States. Even within the United States, when you look at certain states that have decriminalized marijuana, for example, versus other similar states that have harsh penalties, Maine, for example, is decriminalized up to a couple ounces of marijuana and has the lowest teen use rate in all of New England, whereas neighboring New Hampshire, which has harsh criminal penalties for possession, has higher teen use rates. Same in the Deep South. Mississippi actually decriminalized marijuana in the 70s and has lower teen use rates than neighboring Alabama, which has harsh criminal penalties. So there's no evidence to this notion that by regulating marijuana, we're going to have necessarily more teen use.
Mr. Sabet.
Thank you. Well, a couple things we need to clarify. Portugal has not legalized any drug. Let's
decriminalized
be very clear.
all
they
drugs.
have it basically. Yeah, well, you said legalized. Okay, glad you corrected it. They have a version of decriminalization. The issue of the Netherlands is they've always had lower. Frankly, almost every country in Europe has always had lower levels of violence, of alcohol abuse, of drug abuse, of all these things. And yeah, that didn't change. Although in the Netherlands, when they became more permissive, youth marijuana use actually tripled 300% from the 80s to the 90s after they had that. The notion I think we haven't talked about that we do is the connection to mental health. And the reason why Mental Health of America, the reason why the mental health associations, the National Alliance for Mental Illness, the reason why someone like Patrick Kennedy has joined, and I think it's an affront, Dan, to say that, you're giving me too much credit here to say that I'm the only one here opposing it. I'm joined by almost every major medical association, including mental health groups and people like, Congressman Patrick Kennedy from the left and David Frum and David Brooks on the right, a broad coalition of folks who agree and have seen the research regarding schizophrenia and psychosis, have seen the research regarding depression and anxiety. And I think we can argue about the policy, and Dan, you and I will come out on different sides, but the idea of questioning the science and what the evidence has shown and what the major medical groups have said, I think is a bit more than just a bit disingenuous. This is, frankly, something that we need to have a much more accurate, honest conversation about in terms of whether we should legalize marijuana or not. And right now, it's the medical groups and the scientific groups and the other people on one side, and frankly, a lobby that stands to make a lot of money on the other.
So we've talked about it for an hour and 10 minutes plus now, but before we go, I want to get your quick thoughts on what's next. Now that we've seen Colorado, what do you look at next personally as far as the topic is concerned? Mr. Sabet, we'll start with you.
Well, I think that we're going to see in the next couple of years, we're going to be looking at Colorado and Washington. Frankly, it may take us a while to see the long-term effects of Colorado and Washington at a time when, there are a few billionaires that are pumping money into these other states to legalize. So, we'll see what happens there. We're watching Alaska and Oregon. Legalization just failed in Rhode Island the other day. There was no mention of that. It's actually, I don't think on the state legislature level there's a serious effort, frankly, neither on the federal level either. You're going to have the lobby go state by state, and frankly, I think it has quickened a lot of people and woken a lot of people up who normally would not be engaged in this issue. But now they see this as real. They see the advertising, and they are bombarded. Even the caller who agreed with legalization from Colorado said he's bombarded by the advertising and the marketing for this. And I think that's actually going to wake up a lot of people, and people may have second thoughts. I don't think it's going to be as easy of a road as we're sort of hearing from a lot of the proponents.
Mr. Riffle.
So what's next is a lot of other states are going to follow the path that Colorado voters and Washington voters have beaten. In 2014, we'll see initiatives in Oregon and Alaska to tax and regulate marijuana. In 2016, we'll see an initiative that will pass in California to tax and regulate marijuana, where, just to address one of Kevin's concerns about the idea that the scientific and medical community is universally opposed to legalization, the California Medical Association actually supports taxing and regulating marijuana. Arizona, Nevada, and Maine are other states that are going to pass initiatives to tax and regulate marijuana in 2016. And state legislatures around the country are also looking at this. Kevin said somehow that legalization had failed in Rhode Island. That's not true. The governor simply questioned whether he would support it or not. But the legislative session is just getting underway, and there hasn't been a vote on that issue yet. New Hampshire, Maryland, Delaware, Hawaii, those are also states that are looking at this in their state legislature. And I think as we see more and more states do this, we're going to see more and more federal officials change their perspective too and come out in favor of legalization, as has happened over the last couple of years.
Two guests joining us for this discussion today. Dan Riffle of the Marijuana Policy Project. He's their federal policy director. Kevin Sabet of Smart Approaches to Marijuana. He's their co-founder. I hope both of you come back sometime and talk about this as we see what's going on with it. Thank you both.
Thank you, Pedro.
Thank you so much, Pedro. Thanks, Dan.
Thanks, Kevin.
Coming up on the program, we will take our turn and look at the FBI. The primary mission of the FBI has been law enforcement. However, there's been a change, and we'll discuss that change with Ray Tarici of the FBI Agents Association as Washington Journal continues after this.
Nancy Reagan was the first sitting First Lady to address the United Nations and the first to address the nation in a joint appearance with the President.
So to my young friends out there, life can be great, but not when you can't see it. So open your eyes to life, to see it in the vivid colors that God gave us as a precious gift to His children, to enjoy life to the fullest and to make it count. Say yes to your life. And when it comes to drugs and alcohol, just say no.
First Lady Nancy Reagan, as our original series, First Ladies, Influence and Image,